Thank you. Good morning, Mr. Chair, Vice Chairs Anderson and Wallen, and esteemed committee members. For the record, my name is Travis Nelson, and I'm honored to represent House District 44, North and Northeast Portland. Today, I bring to you the voice of the healthcare community, not only as a legislator, but as someone who has been a nurse for 20 years now. During my time at the bedside, I've been hit, spit on, and punched too many times to count. I'm here to strongly advocate for House Bill 4088, a bill designed to confront the growing violence against healthcare workers in Oregon. I consistently hear from nurses and hospital staff that they do not feel safe, a sentiment that is supported by data. A survey conducted in Oregon in 2022 found that 70% of emergency department nurses experienced assault at work, with 30% reporting having been assaulted 1 to 3 times in the past year alone. These pervasive incidents are not unique to Oregon. On average, 57 nurses are assaulted daily across our nation, and we know that most assaults go unreported. However, statistics do not capture the entire story. This issue concerns real people who dedicate their lives to caring for others, yet continue to face risks of harm in their workplace. It's time we stand up for them. I want to extend my gratitude for the time and feedback received from various stakeholders. I'd like to take a moment to thank Representative Boshart Davis for working on this issue for the last several years and working with me since last session on what has become House Bill 4088. I want to extend a special thanks to the DAs, hospitals, doctors, nurses, therapists, nurses' aides, and other healthcare workers and labor unions for helping to shape an amendment that I believe reflects the values of everyone in our coalition, and most importantly, begins to address this critical issue. So let's delve into the specifics of House Bill 4088 with the -2 amendment. House Bill 4088, as amended, expands the crime of assault to the 3rd degree to anyone who intentionally and knowingly causes physical injury to a working person within the hospital that is acting in the course of official duty. Hospitals that provide inpatient mental health treatment to adults and adolescents are exempt from the enhanced penalty. I repeat, hospitals that provide inpatient mental health treatment to adults and adolescents are exempt from the enhanced penalty. This exemption includes the Oregon State Hospital. Hospitals will also be required to display signs near all entrances that will inform the public that injuring hospital workers is a crime. Signage will be required for employees to inform them of their rights to report assaults and inform them of their workplace protections. These signs will be provided in multiple languages. House Bill 4088 also focuses on preventing workplace violence in hospitals through several measures, most significantly through a grant program that helps individual hospitals to apply for funds to meet their specific needs. Funds will be distributed to the Oregon Health Authority to develop and administer this grant program. Eligibility requires safety committee approval and can be used in supporting measures like implementing metal detectors, staff training, and additional violence prevention and protection measures. Priority will be given to rural and critical access hospitals. We understand the importance of safety committee representation from the voices of those who are living and working in hospitals. So this bill will also ensure hospitals with unionized employees be required to include labor representatives in safety committee meetings as non-voting participants. Under this legislation, hospital employee name badges will only include the first name of the employee unless the employee asks to include their last name or if required by federal law. This is a measure that has been requested by employees to protect their privacy and safety. And lastly, we have ensured enhancements in reporting to increase transparency about workplace violence. Authority will be granted to DCBS to collect workplace violence data sent to federal OSHA. I strongly believe that House Bill 4088 adopts a comprehensive approach to addressing workplace violence, a step that is long overdue. I urge the committee to vote yes and support this crucial bill. This is the step Oregon needs to safeguard our healthcare workers and, by extension, our entire community. Thank you for your time and attention to this vital issue.
Thank you, Representative Nelson.
Thank you.
Chair Krupp, Vice Chairs Anderson and Wallen, members of the committee. For the record, my name is Shelley Boshart Davis, and I represent the good people of House District 15 in the Greater Albany area. Thank you for the opportunity this morning to testify in support of House Bill 4088. I want to start off by sincerely thanking Representative Nelson for helping with this bill and hopefully getting across the finish line. I honestly don't think that I could have done it without your help. He mentioned the interim and the diverse group of stakeholders. I can't thank all of those people at the table enough for spending hours and hours of their valuable time spent to protect hospital workers from violence. For that, I'm happy to report that we are at a place of consensus. I was first introduced to the problem of violence against healthcare workers from my sister Ola, who has been an emergency department nurse at Salem Hospital for 20 years. To be honest, I was shocked at the stories I heard that I've compiled over the years of working this bill. This should not be their reality. Representative Nelson mentioned 70% of nurses are assaulted at work. Please know, in response to that, 66% of nurses support an enhanced penalty for this assault. Nurses and all hospital workers obviously want to be safe and be able to do their job. House Bill 4088 answers that call. These are the same protections afforded to public transit workers, EMS workers, taxi drivers, and highway flaggers currently in the law. Rep. Nelson already touched on the provisions of the bill in the -2 amendment, but I want to reiterate my support specifically for the grant program here as well. It's important that this grant program is flexible to the needs of each individual hospital. It's not a one-size-fits-all solution because the safety needs of a hospital in Portland are not going to be the same as they would be, say, in Pendleton, Klamath Falls, or my hometown of Albany. Being responsible to the diverse needs of Oregonians at different hospitals was important. This bill will protect hospital workers and allow them to do their job, of which I am very, very thankful they answered that call as their choice of career path. I urge your support of House Bill 4088. Thank you.